Today we are looking at a medical protocol that involves, well, taking highly purified DNA extracted from the sperm of trout and injecting it directly into some of the most sensitive, intimate areas of the human body.
Yeah, it sounds intense right out of the gate.
It really does. And the wildest part of this entire concept, it's completely revolutionizing how we treat the most painful, silent symptoms of menopause. So welcome to the deep dive. We have a fascinating stack of material in front of us today.
We do, yeah. It's a really interesting mix.
Right. It's a mix of clinical trial data, medical journals like obstetrics and gynecology reports, and advanced aesthetic clinic protocols.
And it all points to this one specific treatment.
Exactly. Our mission for today is to figure out exactly what these intimate polynucleotides are made from, why human tissue responds to them so dramatically, and how this, bizarre-sounding science is offering a completely non-hormonal lifeline for aging tissue. Okay, let's unpack this.
I mean, it is a profound shift in regenerative medicine. For decades, the specific intimate health concerns of women have been either minimized or just, managed with a very limited toolkit.
A temporary toolkit,
Yeah.
exactly. Temporary fixes. But this protocol represents a completely different philosophy. We are no longer just masking a symptom or temporarily plumping up thinning tissue. We're actually delivering a biological code that instructs the tissue to repair itself from the ground up.
Okay, but before we get into what this biological code actually does, we need to address the elephant in the room.
The source material.
The source material, yes. Because our primary focus today is really drilling down into what intimate polynucleotides are made from. And it's a starting point that is guaranteed to raise some eyebrows for you, listener.
Oh, absolutely.
Like, these treatments are not synthetic chemicals formulated in a lab. Polynucleotides are highly purified strands of DNA fragments extracted from the gonads, specifically, the sperm cells of salmon and trout. Right? And that origin, the active ingredient, is always the first hurdle for a patient to, wrap their mind around.
I can imagine.
I mean, we are talking about harvesting raw genetic material from marine life to treat human aging.
Wait, hold on, though. Injecting fish sperm into human skin in highly intimate areas.
Sounds like a lot.
Was that not a massive allergy risk? Or a hygiene issue? I mean, it sounds like a guaranteed recipe for a localized reaction, or at the very least, a massive ick factor.
Yeah, that initial hesitation makes perfect sense. But the reality of what is sitting inside that medical syringe is worlds away from the raw material found in the ocean.
Okay.
The crucial mechanism here is a proprietary manufacturing process known as PNHPT, which that stands for polynucleotides highly purified technology.
So it's basically a distillation process.
Exactly.
Like taking muddy, bacteria-filled river water and running it through so many intense filtration systems that it becomes perfectly sterile, medical-grade fruit fluid.
That's a great way to put it, yeah.
You're refining the raw material until its origin is functionally unrecognizable.
Unrecognizable is the perfect word. The PNHPT process is incredibly aggressive. It systematically strips out everything that makes a cell act like a biological entity.
Meaning what, exactly?
It removes all the cells, all the lipids, the cellular membranes, and every single trace of biological debris. Most importantly, though, it completely eliminates the proteins.
Oh, and proteins are usually the culprits behind allergic reactions, right?
Exactly. It's the exact opposite of a synthetic compound that the body might reject. Immunogenic responses allergies are almost entirely triggered by proteins.
Right, okay.
Because this manufacturing process strips those away entirely, you just eliminate the trigger. You are left with a sterile, crystal clear medical gel.
So no fish smell.
Zero fish smell, zero raw material. It's purely biocompatible nucleic acid suspended in water. So the safety profile is incredibly robust. High tolerability and an almost non-existent risk of adverse events.
Okay, that makes the safety aspect clear. But reading through the aesthetic clinic protocols we have here, there is an interesting trend.
The vegan requests.
Yeah, patients frequently ask for a vegan or plant-based alternative. And, I mean, if this purification process is so advanced that it just leaves us with raw biological building blocks, why do we need to extract it from fish? Why not just harvest DNA from a plant?
Well, the clinics note that request constantly. But currently, there are no plant-based polynucleotide treatments that can trigger these same regenerative effects.
Wait, really? None?
None. Trout and salmon DNA remain the absolute gold standard for one highly specific reason, and that's structural compatibility.
Meaning the physical shape and structure of the DNA.
Yeah, exactly. The DNA extracted from salmon and trout sperm closely mirrors our own human biological makeup.
Oh, wow.
The molecular weight, the structure, the sequencing, it just has a remarkably high degree of similarity to human DNA. Plant DNA simply does not share that architecture.
So the body doesn't recognize it the same way.
Right. That specific compatibility is what allows the trout DNA to act as a seamless biocompatible agent in human tissue, rather than being flagged and attacked by our immune system as a foreign invader.
Okay, so you know exactly what this is made from now. Highly purified, protein-free fragments of fish DNA that perfectly mimic human biology. But the natural next question is, why does human tissue actually care?
Right. How does it actually do anything?
Yeah, how does this biological software update work the moment it gets injected into the body?
So the process starts the second that clear gel enters the tissue. Our bodies are just filled with cellular enzymes.
Okay.
When these polynucleotides are injected, our enzymes immediately recognize these long DNA chains, and they begin to cleave them.
Like chop them up.
Exactly. They chop the long strands down into smaller, highly active fragments, progressively releasing tiny nitrogen precursors, things like nucleosides, nucleotides, and nitrogen bases.
So the body is actively dismantling the fish DNA to scavenge the raw materials.
It is scavenging, yes, but it is also receiving a very specific chemical signal. As those DNA fragments are broken down, they specifically seek out and bind to something called adenosine A2A receptors.
Adenosine A2A receptors, okay.
Right, and these receptors are located directly on the surface of human fibroblasts.
And fibroblasts are the cellular factories that produce the structural proteins in our skin, right? They pump out the collagen, the elastin, the hyaluronic acid.
You've got it. And as we age, those factories slow down, they become sluggish.
Sure.
But when the polynucleotide fragments bind to that A2A receptor, it throws a switch. It activates a cascade that instructs those dormant fibroblasts to multiply in number and dramatically ramp up their metabolic activity.
Oh, wow. So unlike a traditional dermal filler that just acts like spackle, literally just filling in a crack in a wall to add temporary volume, this is entirely different.
Entirely different.
This is like sending a targeted biological text message to the construction crew, the fibroblasts, telling them to wake up, bring on more workers, and start building brand new collagen and elastin from scratch.
That's a perfect analogy. And the mechanism goes far beyond just volume, actually. It actively changes the cellular environment.
How so?
Well, for instance, when those receptors are activated, they suppress the production of pro-inflammatory cytokines.
Cytokines being the chemical messengers that tell the body to trigger inflammation, right?
Exactly. By silencing those messengers, polynucleotides combat what longevity scientists call inflammaging.
Inflammaging.
Yeah, it's that chronic, low-grade background inflammation that just slowly degrades our tissue over time.
Ah, okay, that makes sense.
And alongside that anti-inflammatory effect, the A2A receptor activation triggers something called the salvage pathway.
The salvage pathway.
Right, which actively supports the repair of cyclobutane pyrimidine dimers.
Okay, let's slow down on that one because cyclobutane pyrimidine dimers is quite a mouthful. What is actually happening there?
Fair enough, yeah. Think of a DNA strand in your skin like a perfectly straight ladder.
Okay, I'm picturing a ladder.
When your skin is hit by ultraviolet radiation over the years, the energy from that UV light can cause two adjacent rungs on that ladder to fuse together inappropriately.
Oh, yikes.
Yeah, that physical kink, that structural damage, is a dimer. It basically prevents the skin cell from replicating correctly, which leads to visible aging and thinning.
And the fish DNA fixes that kink.
It does. The body utilizes the salvage pathway to take those broken down nitrogen bases from the injected fish DNA and essentially uses them as replacement parts.
That's incredible.
It repairs the structural damage at the molecular level. Add in the fact that polynucleotides act as a powerful antioxidant, scavenging the free radicals that cause oxidative stress, and you have a really multi-layered regenerative engine.
It's just wild to think about. It is functional cellular repair, not just a cosmetic plump. And for you listening, if this sounds like some trendy, untested fad that just popped up on social media, it's crucial to understand the deep history here. This is not a new invention.
Not at all. The heritage of this specific science provides a lot of necessary context. Polynucleotides actually received pharmaceutical approval back in 1994 in Italy.
1994, so this has been around a while.
A long while. Yeah. But they were not used for aesthetics or anti-aging back then. They were utilized in hospital settings for severe wound healing.
Like burn victims.
Yeah, we were talking about treating deep skin ulcers, diabetic foot ulcers, and serious connective tissue disorders.
So it basically spent decades being proven in burn wards and wound care clinics. It had to prove it could rebuild destroyed tissue before it ever reached the aesthetic market.
Exactly. There are over 70 years of underlying research behind the raw material itself, and decades of clinical evidence proving its safety and efficacy in the most compromised patients.
Right, so we understand the intense purification of the salmon and trout DNA, and we understand the regenerative cellular mechanics. But how did we get from wound care to utilizing this specific science in the vulvovaginal area?
Well, the leap makes total sense when you look at a very common, deeply disruptive, yet historically underserved medical condition. The clinical data we have focuses heavily on genitourinary syndrome of menopause, or GSM, and vulvovaginal atrophy, or VVA.
Right, and the impact of these conditions is staggering when you actually look at the physiology, because during menopause, estrogen levels plummet.
They do, yeah.
And estrogen isn't just a reproductive hormone, it acts as a primary signaling mechanism for the extracellular matrix in the vulvovaginal area. It keeps the tissue thick, hydrated, and elastic.
Exactly. When that estrogen signal drops away, those cellular factories we talked about earlier, the fibroblasts, they essentially shut down. The tissue just starves.
It just stops rebuilding.
Right. The architecture of the vulvovaginal and vesicurethral areas literally collapses. The tissue loses its subepithelial collagen, its elasticity drops, and the mucosal lining thins out dramatically.
And the clinical result for the patient is severe vaginal dryness, tissue fragility, chronic itching, burning, and dyspareunia, which is the clinical term for painful intimacy.
The psychological and emotional toll is profound, too. Surveys across Europe indicate that more than half of women experience these severe structural symptoms within 4 to 5 years after menopause.
Over half. That's a huge number.
And half those women reported actively avoiding intimacy entirely, out of fear of the pain it causes.
There is a detail in the clinical data that paints a really vivid picture of this. During an examination of postmenopausal women suffering from dyspareunia, doctors perform what's called a Q-tip test.
Right, the Q-tip test.
Just a simple, light touch of a cotton swab over the vulvar vestibule evokes high median pain scores. The tissue becomes so fragile and so hypersensitized from the loss of structural support that a cotton swab feels agonizing.
It illustrates perfectly why a purely cosmetic or superficial approach just isn't enough. The tissue needs foundational rebuilding.
Why go through a specialized injection process, though? I mean, if you look at international medical guidelines, they already suggest over-the-counter lubricants and moisturizers as a first line of defense.
Yeah.
And hormone replacement therapy, or HRT, is widely prescribed. So why introduce fish DNA into the mix?
Well, the guidelines suggest lubricants primarily because they have zero side effects, making them a very easy first step. But they only offer a temporary surface glide.
They don't fix the underlying problem.
Exactly. They do absolutely nothing to reverse the actual architectural collapse of the tissue. The moment the lubricant wears off, the fragility is still there.
It's the symptom then patch mentality.
Right. And while localized estrogen therapies like HRT are incredibly effective at reversing the atrophy, a massive segment of the population simply cannot take them.
Due to health risks?
Yeah, women with a history of estrogen receptor-positive breast cancer, endometriosis, or certain vascular issues, they have strict contraindications.
That makes sense.
Plus, a lot of women simply choose to navigate menopause without introducing exogenous hormones into their system.
So historically, those women were just told to manage the discomfort. They were left to suffer through the structural decline.
Unfortunately, yes. But regenerative medicine changes that entirely. Polynucleotides provide a completely non-hormonal, biocompatible solution that actually thickens the fragile tissues.
It gets in there and rebuilds.
It restores the natural mucosal balance and physically rebuilds the elasticity, all without altering the patient's systemic hormone levels.
And the protocols detail specific products engineered for this exact purpose. The treatment highlighted heavily in the literature is called Nugen. And it's not just a syringe of pure polynucleotides, is it? It's a highly calculated, multi-ingredient formula.
What's fascinating here is how they work in synergy. The Nugen protocol is a prime example of targeted biological engineering. It combines 20 milligrams of the highly purified polynucleotides with 20 milligrams of non-cross-linked hyaluronic acid, or HA, in a single syringe.
Okay, so DNA and HA.
And crucially, it includes a third ingredient, Mannitol.
Right. I noticed the mannitol, which is usually a diuretic. It seems completely counterintuitive to include a diuretic when your entire goal is to hydrate the tissue with hyaluronic acid. What is it doing there?
Yeah, it's a good question. In this specific formulation, mannitol isn't functioning as a diuretic at all. It acts as an antioxidant shield.
The shield.
Yeah. Hyaluronic acid is fantastic at drawing in moisture, but our bodies naturally produce enzymes that break it down very quickly. Add in oxidative stress, and the HA degrades before it can provide lasting hydration.
Oh, I see.
Mannitol inhibits that enzymatic and oxidative degradation. It essentially wraps around the hyaluronic acid, protecting it and prolonging its hydrating effects in the tissue.
So you have the fish DNA fragments, the deeply hydrating hyaluronic acid, and the mannitol acting as a bodyguard for all of it.
They work in absolute calculated synergy. The polynucleotides act as the primer. They send that long-term biological command to the fibroblasts to wake up, increase cell turnover, and start the slow, steady production of new collagen and elastin.
But because building a new collagen matrix takes weeks or months, the patient needs relief right now, right?
Exactly.
So the hyaluronic acid acts as the consolidator. It provides massive, immediate hydration to the extracellular matrix, restoring the immediate moisture and volume to relieve the pain, while the polynucleotides work in the background on the long-term architectural repair.
Primer and consolidator. Immediate symptom relief coupled with long-term biological regeneration.
It sounds like a miraculous mechanism on paper, but theory is just theory. What actually happens to a patient's quality of life when this specific protocol is tested in a clinical setting?
The data answers that beautifully, actually. A standout is the 2019 prospective cohort study conducted by Palmieri and Ricci.
Okay, let's get into the study. They took 19 postmenopausal women, all aged 50 to 65. Every single woman in the study had confirmed vulvovaginal atrophy, and their symptoms had persisted for at least a full year without relief.
Right, so these were chronic cases, and the treatment protocol was very meticulous. The women underwent 3 priming sessions using the highly concentrated polynucleotides, spaced a few weeks apart.
Okay.
This was followed by 2 consolidation sessions utilizing the hyaluronic acid blend.
Now, for you listening, if the idea of injections in this area sounds intimidating, it is really worth understanding how it's actually performed.
Yeah, people get very nervous about that part.
Understandably. But this is not a deep surgical procedure. The doctors administer intradermal injections directly into the vulvar vestibule, so just the superficial layers of the tissue, and they use a topically applied anesthetic cream beforehand so the patient is comfortable.
Yeah, the physical technique involves what they call linear retrograde injections and microwheels.
Which means what, visually?
Imagine a very fine 30-gauge needle creating tiny, strategically placed reservoirs of this gel just beneath the surface of the skin. This ensures the maximum spread of the DNA fragments across tissue that has lost its elasticity.
Okay, that makes sense. And the results from this specific cohort?
Statistically highly significant and remarkably rapid. The women experienced a massive improvement in their daily symptoms after just the first 2 priming sessions.
Oh, wow, that fast.
Very fast. The scores for chronic itching, soreness, tenderness, and tingling dropped by over 50% almost immediately. Just an absolute plunge in daily discomfort.
That's huge.
And the long-term metrics are even more compelling. By the end of the 90-day follow-up period, the clinical scores for dyspareunia, that's severe pain during intimacy, along with extreme vaginal dryness, fell by nearly 60%.
A 60% reduction in pain for women who had been suffering for over a year.
And the compliance rate for the study was 100%. No one dropped out, no adverse events or allergic reactions were reported, and all 19 women expressed high satisfaction with both the physical relief and the aesthetic restoration of the tissue.
The clinical takeaway is undeniable. The authors concluded that the bioreactivating properties of polynucleotides, particularly when combined with the immediate hydration of hyaluronic acid, effectively translate straight from facial dermatology and wound care into treating postmenopausal vulvovaginal tissues.
It's a huge leap forward.
It really is. Which brings up a crucial point. Why should you care about this, even if you aren't currently dealing with menopause symptoms, or even if you don't have this specific anatomy?
Right. Why does this matter to the average person?
Exactly. Understanding the science is vital because it acts as a window into a massive paradigm shift in modern medicine. We are officially moving away from an era of merely managing the symptoms of aging with temporary, surface-level fixes.
Yes, absolutely.
We are stepping into an era where we can actively regenerate damaged tissue at a cellular level, and we're achieving this by utilizing our deep molecular similarities to the natural world.
That is the core takeaway of regenerative medicine. It is the transition from symptomatic relief to structural biological restoration. By utilizing highly purified DNA from fish, we are literally speaking the language of our own cells, providing them with the exact raw materials and signaling commands they need to heal themselves.
So, to summarize this incredible biological journey, we start with highly purified DNA extracted directly from the sperm cells of trout and salmon. Through an intense protein stripping purification process called PNHPT, this raw marine material is transformed into a sterile, non-allergenic, highly biocompatible medical gel.
Right.
And when this gel is injected into the thinning, fragile tissues of the vulvovaginal area, it binds to specific cellular receptors. It sends a direct biological command to the body's fibroblasts to wake up, suppress chronic inflammation, repair underlying UV damage, and rebuild the tissue's collagen and elastin from the ground up.
It's just brilliant.
It's a breakthrough, entirely non-hormonal regenerative therapy that is fundamentally changing the landscape of intimate health. It's restoring comfort, function, and confidence to women who, for decades, really had very few viable options.
It illustrates perfectly how elegant and sophisticated our therapeutic toolkit has become.
Mm.
We aren't just filling empty spaces anymore. We are providing the exact biological instructions needed for the human body to reverse its own decline.
So what does this all mean?
Well, it raises a profound question, and it is something I think about constantly when reviewing this level of regenerative data. If we can successfully harness fragments of fish DNA to trick our aging intimate tissues into acting young again, repairing their own structural damage, and reversing years of decline,
Yeah.
what other hidden biological instruction manuals might we eventually borrow from nature? Like, if this is the profound level of cellular manipulation we can achieve today, how else might we completely rewrite the aging process across the rest of the human body tomorrow?
That is a wildly fascinating thought to leave on. From patching up a temporary symptom to literally rewriting the biological code of our own cells using the blueprint of the natural world. Thank you so much for joining us on this deep dive. Keep learning, stay curious, and we will catch you next time.